Hi everybody, welcome back to my channel. Today I will be heading in a little while to um to the hospital again. My hospital has been my new second home. Anyway, for this visit I will be having a consultation with the radiologist oncology doctor, and we'll be discussing about my chronic illness and God knows what, and what to expect in my treatment and what's the treatment plan. So it should be a very interesting conversation, and I will be giving you guys a breakdown like what is going to come next after my surgery. So please stick around and I will be back soon. Hi, I am back. It's been a few hours since I got back from the hospital. I just needed a rest a little bit, and I'm really exhausted. I mean, going to this appointment, it drained me out. It just drained me out physically. So right now I'm struggling just to stay awake. But hey, I'm trying to make this video quick. I'm not gonna let this drag. All right, so I was there at the oncology section of the hospital, and I was there for 2 hours. So I had to go through the initial registration paperwork. Then the patient navigator came and picked me up. She called me. I went with her. We went to the room that was designated for me. And then she gave me a rundown of, who she is. That she's like the liaison of, the oncology, radiation oncology department. So like if I have any questions or any concerns, then I could reach to her. She gave me her card. She gave me a lovely folder. I'm a lovely little folder that that has a whole bunch of paperwork in there. A lot of reading material for me to learn about their process of doing the service regarding to radiation therapy, the list of doctors that are working in this unit, the different organizations if I need to reach out, how they work the process of of the radiation treatments, and let me see what else. And then my care providers, and the basic stuff, information of billing and stuff like that. So she gave me that lovely reading material, which I will read through it. Then after that, I thanked her, and then she says, well, now after me, you're gonna meet with the nurse, and then the nurse, then the resident doctor, and then after that, the official doctor that is in charge of my care. So I was like, okay, this no problem. It's gonna be a long one. So I waited for the nurse. Where the nurse came in, she took my vitals, she took my blood pressure, my temperature, and she weighed me just to keep on record. And then she asked me a couple of questions regarding about how long did I find out that I have like breast cancer, and I told her, I just like, listen, I just went through a regular routine, and they showed up my mammogram, and then I had my biopsy last week, and then I had my meeting with the with the surgeon. So everything's quick in my world. And I'm already scheduled for next week. So I don't know. She was like, wow, everything's really quick for you. I'm like, yeah. So then she says, okay, then I'm gonna notify the resident doctor, the resident doctor, that you're here, and he's gonna come in. He's gonna ask you a bunch of questions. Sure enough, he came in a little while after and asked me a whole bunch of questions about what medications I'm taking. So I had the list ready of my medications, my supplements, and then he wrote down. And so he told me that after I go through my surgery, I won't be able to take vitamin C and turmeric, because that's one of those things that I can't have in my body, especially if I'm having radiation, because of the fact that it causes like some sort of toxin in my body, and especially antioxidants, it will create an adverse reaction with the radiation. So that is going to be eliminated for now, and so way after I'm done with radiation. So now I know C complex, B complex is going to be a no-no, and turmeric is not going to be a part of my supplements for a while. Then he asked me about any health conditions recently and past, and so I broke it down like, I have UCTD, I have abnormal MRI with neurology. I broke it down from the COVID to neurology issues, vascular issues, my past history of surgeries, and how I'm feeling now, and regarding to my illness, with UCTD, what effects I'm having from it, how it started. So it's just like detailed questions, because in order for them to do some sort of plan, they gotta make sure that I don't become, I don't get a radiation that's gonna cause harm to me. And so he had to go through all this stuff so he could relay it to the doctor, and then the doctor could figure out whether I should be the candidate to get radiation in the next few weeks. And then he told me about how the radiation is going to affect me physically, that since I have UCTD, they gotta really think this through. He needs to relay this information to the doctor, because they don't want to add radiation to me if my illness is progressed, because at some point, if I have a reaction from the radiation, then I could wind up having fibrosis in the breast. And it became so technical on this. I was just like, wow, here we go. So I was assuring them that I haven't had any major flare-ups for the last 2 years. So I was really in detail on how I am physically, and how the flare-ups affect me. And I told them it usually affects me when I'm in severe stress. And I said to them, it's a miracle that I haven't gotten a flare-up, because of the amount of things that I've been going through for the past already year and a half, almost 2 years. But I'm trying to take things one step at a time. I'm trying to keep grounded, because I'm not going to lose my mind for anything or anybody. So, he relayed, all the information I gave him, medical history, all that stuff. So he relayed it to her. So he told me that The radiation is going to be 5 days a week. But before radiation starts, um, once I have the surgery, it's going to be a month before I get. Sorry about that. Let me sit up. Sorry about that cutoff. I wind up having a call. My sister was calling me, and I was just like, damn it. Yes, I said it. So, yeah. So, in the last part, I was saying is that it's going to take actually a month before I will start the initial treatment because, one, they don't want to intervene of my post-op follow up with my doctor. And what happens is that once they take that sample and send it to pathology and they make sure that they caught everything that they caught on this, out of my breast, and if they see any cancers, possible cancers that is still lingering in my breast, then they might have to do a second surgery. That's a small percentage possibility. So they feel like they're not going to intervene on my process, with my follow-up care. So they decided to do was said to me, we're going to wait a month for you to completely heal from the process of, surgery. And then we're going to schedule you in to get a CT simulator. Now, this CT simulator is basically like a CAT scan that they're gonna do, but on my breast. And what it is like they need to measure out exactly where they're gonna do the treatment on my breast. So they have to position my body, figure out the position, and then once they get the precise area they're gonna do the radiation, then they're gonna do is place these tattoo. They're gonna mark my body with tattoo in different parts of my body. So then when I come in for my treatment, I have to go into that same position when I go in for my treatments. So she said, she told me, because they both told me, doctor told me the longest day is gonna be that CT simulator. So it's gonna take about 2 hours for me to get that done. So I'm not looking forward to this one. So 2 hours I'm gonna be there. And they describe about how, they're gonna do it. They're gonna place me in a room, position me the way I'm gonna be positioned, get the right measurements and all that stuff. And then when I come in for my initial treatment, then that'll be the position I gotta be in when I receive these treatments. And she says their treatments are gonna be 5 days a week, 15 minutes a day. She possibly think it might be 3 weeks I'm gonna get treatment, but still they gotta go through the process, because the thing is, after the simulation, it's gonna take a week for them to put together a plan for me, because they have to take consideration of one of my illness and all these other factors too. So it's gonna take a week to build a plan, my treatment plan, and then once they got the treatment plan together, then they'll schedule me in for my treatments. Possibly 3 weeks, but still things could change, especially with my world. We all know that my world has changed a lot. So that will be the game plan. So once the treatments are happening, I will be expecting a lot of changes on my body, especially where radiation is concerned, because I will be experiencing a lot of fatigue and very sleepy, weakness in my body. Also, there's gonna be, she says that I'm not gonna feel the radiation hitting me, but I will see effects of like sunburn on the area of my breast. And they're, once I let them know, hey, I'm developing these sunburn, then they're gonna start treatment on my skin, just to make sure that I don't get severely problems on my skin. So they have to do some sort of treatment on my breast. These treatments, they say it's gonna be very consistent because of the fact that a lot of people experience a lot of sunburn, like a sunburn feeling. It'll be like redness, and then I'm gonna start peeling, and then she says that it's gonna be on and off feeling like that, and then after the treatment, usually it gets worse once radiation treatment is over, because then the breast gets more severe pain, like a pain of like burning pain. So then they have to do more treatment on the breast. So got a lot to look forward to. But so that's, I'm just giving you the gist of it, because later on I will be filming every I probably will break it into 2 videos, because if I'm doing it 5 days a week, and there's no sense I'm doing one huge video on that whole week. So I'll probably break it into 2 videos on that week, and whatever appointments I have between. So at least I'll give you guys a heads up of how I'm doing each day on those appointments for each week. And I am not really looking forward to this, but I am accepting the fact that these things, I have to go through it. Am I scared? Yes and no. Because I have so much faith in God that, I feel like I'm being protected regardless. And, I'm just accepting the fact that this is my new norm for now, that I gotta deal with these physical changes. But I am praying that I could get through this difficulty in my life. It's not easy. It's definitely not easy, and I'm not gonna play it off like, oh yeah, everything's peaches and cream. It's not. My life has never been peaches and cream. It's always been a battle with something or someone. So I'm just gonna toughen it out. Alrighty, so now all I gotta do is wait for my appointment, because for some reason they're supposed to schedule me an MRI appointment before Thursday's needle insertion, like the wire. They're supposed to insert a wire in my breast for Thursday, and so far I'm supposed to have an MRI done. I haven't heard anything from anybody, so I don't even know how this is gonna work out. I don't know if they're gonna have to cancel my needle appointment, and I don't know. I am just kind of lost right now. So I should hear something from the hospital tomorrow, because I related to the doctor. I was like, listen, I haven't gotten a call, because she's telling me, oh, you're gonna have your MRI done, right? I'm like, nobody called me. She was like, what? I was like, yeah, nobody called me. And I said, because I'm having the other procedure on Thursday, so they need to let me know ASAP, like when I'm having this, because I think my schedule for Thursday is 12. So if I have to be at the hospital, it has to be by 8 o'clock in the morning, you figure. But we'll see what happens. That'll probably be the crazy vlog of like, yeah, my world is upside down that day. Anyway, so this is pretty much it for now. I will definitely give you guys a breakdown of anything else that happens along the way. Anybody that's tuning into these videos, these cancer videos, please give it a like. So anybody that are going through what I'm going through, they can see my story and know that this is what they might have to go through. Like the plans are not going to be the same. Everybody's journey is different, but at least they have an idea what's the process is like. All right, so please give the video a like. If you're new to the channel, please subscribe, and if you have any comments or share stories with me about your own cancer journey, I would love to hear it from you. Alrighty, so please stay safe, stay blessed, and I'll see you soon in my next video. Bye.